Hello everyone, welcome back. Kindly make sure you subscribe before we begin our session. Let me just type something. So, in today's session, we are going to talk about septic arthritis. Yeah, the quality is not that good. I don't have enough lighting. All right. Anyway, as long as you can hear my voice, that's it. So, septic arthritis, this is exam friendly way, not in details, but exam way. Okay, so you're going to rush through it, just the most important points for you to prepare for your exams. Okay, so I have my reference with me here. Yeah, so septic arthritis. So what is the mechanism of infection? We can have three mechanisms. One, direct invasion, either through a penetrating wound, an intraarticular injection, or arthroscopy. So that is direct invasion. Two, direct spread from an adjacent bone abscess. It can just spread directly. Then three, broad spread from a distant site. Yeah. So we can have the three mechanisms of infections: direct invasion, direct spread, and blood spread from a distant site. So what are the causal organisms? So the most common here we have Staphylococcus aureus. It's the most common one. For infants, we have Haemophilus influenza, the most common causative organism, that is bacterial. Then the commonest cause of septic arthritis in adults mostly is Neisseria gonorrhea, all right? Gonorrheae, whatever you call it, yeah. And others, we can have Streptococcus species, E. coli, or Proteus. So what are the predisposing conditions? Yeah, so one, we can have rheumatoid arthritis, IV drug use. All these conditions will predispose you to acquiring septic arthritis. So immunosuppression, either HIV or using immunosuppressive drugs, or if you have like a chronic disorder, all right? So what is the pathology? We are going to rush through it. So the usual trigger is hematogenous infection, that is through the bloodstream, which settles in the synovial membrane. Okay. There is an acute inflammatory infection when the organism travels through blood, which is the usual trigger, travels through blood, then it settles at the synovial membrane, where acute inflammation reaction starts, causing acute synovial joint. What is the inflammation of synovial joint? Synovitis. Okay. Pardon my pronunciation. Anyway, that one with a serous or seropurulent exudate and an increase in synovial fluid. So when it attacks the synovial fluid, there's that acute inflammation. So uh, leading to that, what is it called? Acute synovitis. Yeah. Then with a serous, it can be serous or seropurulent exudate, and it will cause an increase in the synovial fluid. So a sparse appears in the joint. So articular cartilage is eroded and destroyed partly by the enzyme released from the synovium or inflammatory cells and pus. Okay, so through this section, if it is bacterial and all that, there'll be pus formation. So causing the cartilage to be eroded and destroyed, can either partly destroyed or that. So released by either the enzymes released from the synovium or from the inflammatory cells in the pus. So what is it called? Bone infects the entire epiphysis, which is still largely cartilaginous, may be severely damaged, and in older children, Vascular occlusion may lead to necrosis of the epiphyseal bone, and in adults, these effects are usually confined to the articular cartilage, but in the late cases, there may be extensive erosion due to synovial proliferation and growth. If the infection goes untreated, it will spread to the underlying bone or burst out of the infection to form abscesses and what is this called? Is it sinuses, something like that? So we are told here in infants, travel through the entire epiphysis, all right, which is still cartilaginous at this point, and it might be severely damaged, okay? But in older children, this vascular occlusion may lead to necrosis of the epiphyseal bone, and in adults, the effects are usually confined to the articular cartilage. Have you got the difference? Yes. So, but in late cases, there might be extensive erosion, all right, in adults due to synovial proliferation and growth. If the infection goes untreated, what will happen? It will spread to the underlying bone or burst out into the joints to form abscesses and sinuses. All right. So, with healing, there may be one either complete resolution and return to normal. Two, another possible outcome is partial loss of articular cartilage and fibrosis of the joint. Three, we can have loss of articular cartilage and bone ankylosing. And four, we can have bone destruction and permanent deformity of the joint. So one, we have said, what is the effect of this acute inflammation or arthritis? One, we can have complete healing. Two, partial loss of the articular cartilage and fibrosis of the joint. Three, we have loss of the articular cartilage and bone ankylosing. Four, we have bone destruction and permanent deformity of the joint. All right. Yeah. So, what is the clinical presentation? So in children, usually a large joint, commonly the hip, presents majorly on the large joints, like the hip. And for adults, mostly it's superficial joints, example, the knee, the wrist, or the ankle. So the clinical features or clinical picture, this person will present with acute pain, of course, because you've said it. Sepsis and that acute inflammation leads to pain also. So swinging fever, if it is bacterial and all that, all the what is it called? Features of inflammation will usually present in this case. Yeah. So rapid pulse, overlying skin looks red. You remember those the P's, what are they called? Features of acute inflammation, yeah, they all appear here. They can apply here because it's part of an acute inflammatory process. All right. So there'll be local warmth and marked tenderness and reluctance to move the limb. All right. So it's just a pseudo paralysis, but it's just like reluctance, not permanent paralysis. Okay, so the movement will be restricted and often completely abolished because of the pain and the spasms, not because of like damage to the nerves or something like that, just because of the acute pain and the spasms. Okay, so what are your differential diagnosis in such a picture or a clinical presentation of septic arthritis? So one is acute osteomyelitis. Two, we have gout or pseudo gout. We have trauma, yeah, example, traumatic synovitis or hemarthrosis. We also have irritable joint, hemophilic bleed, rheumatic fever, because it typically pain flints from joint to joint here. Then Gaucher's disease, which presents, an inherited disorder. There's an enzyme. What is that enzyme? I've just forgotten the enzyme. Yeah, go and check out the enzyme. So it presents mostly with acute joint pain and fever without any organism being formed. So we also have bursitis, inflammation of the bursa, and so in your X-ray, X-ray will be normal because like it's an acute thing, septic. X-ray, such kind of things. mm, there is like changes in the X-ray after around 10 days or something like that, more than a week. Yeah. So whereby the changes are, you appreciate the changes in X-rays. But for acute or this septic, you won't, the X-ray will just be normal. So what about the full blood count? There'll be increased white blood cells, yes, because there's acute inflammation and all that. And yes, the markers of inflammation will be increased. Okay, so blood culture, when you, it might be positive, yeah, because of that, maybe hematogenous spread and all that. So when blood culture is performed, it might, some, there might be growth, okay, of some organisms. So ultrasound at the joint, there'll be a fusion, of course, because of the pus and all that that you have said. And in children, the joint space may seem to be widened because of the fluid in the joint, okay, that is in ultrasound. And there may be a slight subluxation of the subluxation of the joint. With E. coli, this organism, E. coli infections, there is sometimes gas. You remember the properties of E. coli. What are those? Yeah. Go back to your microbiology and check. So there's also be narrowing or irregularity of the joint space, which is a late feature, of course. So another test that you can do, joint aspiration. So for the aspirate, the leukocyte count, of course, will be increased. Normal synovial fluid leukocyte count also will be below 300 ml. Non-infective inflammatory disorders, they'll be raised more than 10,000 mLs. Yeah. So what is the management of this acute, septic? Why do I keep on saying acute? Septic arthritis. So give analgesics for the pain and IV fluids for dehydration. You rest the joint on a splint or in a widely splint plaster. With hip infection, the joint should be abducted. Do you picture that? Abducted and 30 degrees flexed, all right, and on traction. Most possibly, is it skin traction? Yeah, to manage the pain and to prevent dislocation and to keep the synovial cavity open to allow circulation. Hello, Karim's Fusion. Hello, welcome. We are learning about septic arthritis. Yeah, we are in the management of septic arthritis. So we have said we give analgesic for the pain because there'll be pain. All right. Let me just reply to this quick one. Welcome. Ensure you've subscribed, okay, as we continue. So, we have said analgesics for the pain because you know the acute pain, you give fluids for dehydration, you rest the joint, okay. We have said we can use splints, all right, to just rest the joint and possibly use skin traction. All right, skin traction just to manage the pain, to prevent dislocation, and to keep the synovial cavity open to allow circulation. And in children, this is important to prevent slipping of the upper femoral epiphysis and to strengthen the perichondral ring. Okay, so also give antibiotics. Remember, we have said most of this is caused, they are bacterial cause. Okay, so we give broad spectrum antibiotics to just cover for infections. Okay, so below 4 years, we give ampicillin or third generation cephalosporins. What are that? What is that? Ceftriaxone. Okay, and in older children and adults, we give flu flucloxacin, flucloxacillin. Okay, the pronunciation of this word sometimes. Yeah, and fusidic acid intravenous for 2 to 7 days, and then orally for another 3 weeks. Okay, so in children, we're also told to give cod liver oil, which reduces inflammation by supplying omega 3. How many of you took cod liver oil when we are still young? Okay. Yeah, it reduces inflammation. So reducing the formation of arachidonic acid necessary for the formation of prostaglandins that mediate inflammation. So that is supportive and maybe some definitive. What about surgical? Because something like this, we don't want them to like complicate into serious things. All right, so surgical conditions should be under anesthesia. Okay, so the joint is opened through a small incision, it is drained and washed out with physiological saline, normal saline. A small catheter is left in place and the wound is closed. So the catheter is just draining the abscess and all that. So suction irrigation is continued for another 2 to 3 days. This is advisable in very young infants when the hip is involved and if the aspirated pus is very thick. 2, for knee arthroscopic debridement from the lateral aspect and copious irrigation may be equally effective. So you just irrigate to remove excess pus and all that. And in older children with early septic arthritis, so symptoms less than 3 days involving any joint except the hip joint, repeated closed aspiration. You just aspirate. All right. The joint, however, if there is no improvement within 48 hours, open drainage will be necessary. So we have said in older children, if it is early septic arthritis, that is not the hip joint, you can do closed, closed aspiration. All right. But if there is no relief or no change, you opt for the open, or if the hip joint is involved. Okay, yeah. So I think you're learning something. All right. What are the complications of this septic arthritis? Bone destruction, of course, it might prolong to chronic and all that, and even cause bone destruction. In adults, we have partial destruction of the joint will result in secondary osteoarthritis. Okay, we are also going to learn about osteoarthritis. Okay, so cartilage destruction, of course, which may lead to either fibrous or bony ankylosis, okay, and growth disturbance, of course, if it has affected the growth plate, especially in children and all that, presents either as localized deformity or as shortening of the bone. Then dislocation of the hip if the hip is involved, and osteomyelitis. Okay, all right. I think that will be it about septic arthritis. What have you learned in summary? We have said the major mechanisms of infection, either direct invasion through an opening, we can have a hematogenous spread from a distant site, or direct spread from just an adjacent bone abscess. Then the most common organisms that we have mentioned, Staphylococcus aureus. For infants, Haemophilus influenza. For adults, Neisseria gonorrhoeae. And others, we can have the streptococcal species or E. coli and Proteus. Okay, so predisposing, I've said rheumatoid, IV drug use, and immunosuppression, and all that you've talked about. Okay, revisit the pathophysiology. This is just a quick summary, all right, to help you just recap some of the major points that you need to remember before you sit for your exams. Okay, so for the major details, kindly go and revisit your lectures, go and revisit your notes. I think that will be it for today. Ensure you subscribe to this channel because I'll create more videos. Let me know if there is any question that you need me to address. Yeah, something that is not clear and all that. Yeah, you can also comment the next topic that I should handle next. Yeah, okay. So that I may prepare and give you or create a video for you guys. Yeah, so that will be it For now, see you next time. Let me give you 30 seconds or 5 seconds to just subscribe. Yeah, you've subscribed. Bye. Thank you.